Hey guys, so you know I love sharing tools with you guys. Just yesterday I recorded a video showing you the allowed amounts, the fee schedule for Medicare of Ohio, specifically the CGS Medicare MAC from 2023 to 2024. Today, I want to show you a resource put out by Strata PT. Now, I have no direct affiliation with Strata PT. I've been talking to their CEO. I have a history with the company. I am not a customer of theirs. I'm not an affiliate of theirs, but they're the only ones producing this kind of open access tools, resources that would help any physical therapist, occupational therapist, speech language pathologist. So I know a lot of you guys are looking to start your practice. You're looking to decide if you're going to contract with more than just Medicare. So if you do a search for Strata PT physical therapy benchmarks, and this would generally apply to OT as well, you can go into one of their pages. Now, this is the practice metrics page, but what you really want to do is you want to scroll down and you want to find your state. So if I come down here and I go to Ohio, now we're on the Ohio specific benchmarks. And I can tell you, I mean, I've been a practice owner in Ohio since 2006. I've been a practice owner down in Florida from 2001 to 2000, I don't even remember. I'm going to say 17, but that's a total guess. And so if we're looking at this, we can see that average units per visit is 3. Obviously, that's going to vary based on setting. I can tell you that I see patients for single unit visits. I also see patients for 4 unit visits. But if we come down here, first pass clean claim, 97%, pretty reasonable. Denial rate to 2.3%. Again, it's going to depend on who the third-party payers are, what the practices are doing. I can tell you if it was just a Medicare and maybe Anthem Blue Cross, which is one of the big Ohio payers, it's going to be a better rate. But as soon as you start getting into Humana and some of the other big third-party payers, there's typically going to be some issues with denials, rejections, things like that. What's most important here is looking at average reimbursement per visit, $82.15. I can tell you that is exactly dead on. The latest number they are posting is $79.69. Again, if you're looking at an average 3 units per visit, and you're looking at those being direct one-on-one time-based codes, I think you're right in the ballpark. And then we look down here. This is the best part. For those of you who are just getting started or looking to grow a practice, you're thinking, should I contract with third-party payers in my state? These are the resources that you want to see. Nobody else is putting this out publicly for right now. There is a federal law that will require this kind of information get disseminated out to everybody, but it's still not being enforced. So let's take a look at what they have. $73.74. Now you can verify that based on the publicly available Medicare physician fee schedule. And I can tell you for a 3 unit visit, that's dead on. This is including primary Medicare plus a supplemental or the coinsurance that's not covered by Medicare Part B. And then if we look at Blue Cross Blue Shield of Ohio, which is Anthem Blue Cross Blue Shield, $62. Again, if I'm averaging a 3 unit visit, dead on, exactly. Aetna through RPN, there have been some changes to the Aetna network, but you can see the reimbursement rates going down to $56, and you can see United Healthcare at $55. So I've shared information like this before, but this is probably the best resource for any state in the country. Again, you guys can just Google Strata PT, physical therapy benchmarks. It'll take you to the main page, and then you can scroll down and take a look at your state. Now, they also have this how to grow your practice. They have sliders that allow you to control how many patient visits can your practice handle each month. What is your average reimbursement? So for example, if I'm looking at 500 patient visits a month and my average reimbursement goes down to $80 per visit, what is your current reimbursement rate? Obviously, this should be up in the high 90s. I know it's not for a lot of practices, especially small providers, but it gives you some metrics down here. So it gives you an idea of monthly insurance collections, monthly reimbursement rate, all of that kind of stuff. It's if it's optimized for ideal performance. You guys can talk to Strata about that. But for me, I think the most valuable piece of information here is this little section in the middle of the page that shows you what each third-party payer is paying on average for the state based on real-time data.